I'm Dr. Dave Janda. Welcome back to the Operation Freedom Platform and DaveJanda.com and our ongoing health and wellness and empowerment series that Dr. Peter Glidden and I have been doing for, over 2.5 years now. How is it empowerment? Well, by educating you and anyone you pass this video on to, by educating you about the powers of your own body, as opposed to the powers that you're continually told about in the bought-off lamestream fake me about, the only power for your health is, there are a couple, big pharma, big medicine like the AMA, big insurance. Those are the powers that will drive your health and wellness. Nothing could be further from the truth. In fact, one can make a case for the fact that those entities, big pharma, big medicine, big insurance, are actually driving your health not toward wellness, but toward injury. And the reason why this series of presentations is so unique and yet so despised by big pharma, big medicine, and big insurance is because we focus on you and what you can do with your own body and harnessing its health, if you will, healing and wellness capabilities within it that are just itching to be released to do the magic to make you feel better and be better and healthier. The reason why we're despised by these entities is because we focus on you and your education and your empowerment and what you can do without having to go to the trough, pig trough, if you will, of big pharma, big medicine, such as the AMA, and big insurance. It's my honor to welcome back my good friend and one of the top naturopathic physicians, not just in our country, but the world. He is also a fantastic researcher, fantastic clinician, and fantastic author. His 2 books should be the foundation of your medical library, and it's information that you will never get through the bought-off lamestream fake media that's controlled by big pharma, big medicine, and big insurance. The names of the books, available on Amazon and his website, Dr. Glidden, Glidden, drglidden.com. Names of the book, Everybody is Sick and I Know Why, An Attempt to Cure with Holistic Medicine. It's my honor to welcome back our friend and expert extraordinaire when it comes to your nutritional well-being, Dr. Peter Glidden. Peter, welcome back to the Operation Freedom Platform and DaveJanda.com.
Dave, thanks for having me be here. I'm going to float your name for an honorary naturopathic degree because every time that I listen to your introduction, I think that you're a naturopath.
Well, that's very kind. Although, Pete, so you should be, tell me if I'm wrong on this right now, you should be the rule when it comes to naturopathic medicine. However, now tell me if I'm wrong on this, please feel free. When I monitor what's happening in naturopathic medicine, I see more of naturopathic medicine not going toward the foundation of what Peter Glidden is, but more toward what I was brought up in, allopathic medicine, that being through the MD ranks, and the embrace of big pharmaceutical entities. So am I wrong on that?
No, you are 100% correct in that, and this trend started a number of years ago, probably 15 years ago, due to lack of education in the clinical areas of naturopathic medicine. And there has developed a divide in the naturopathic professional naturopathic medical organization between people like myself who actually practice naturopathic medicine, which is referred to in this context as vitalistic naturopathic medicine. It's built on natural law, an understanding of natural law, the belief that the human body knows and wants to fix itself, right? And what we collectively refer to as green allopathic medicine, which advocates for, in the naturopathic medical schools, the use of pharmaceuticals first, and you use naturopathic therapeutics secondarily or tertiarily in order, in large part, to clean up the ramifications of the pharmaceuticals. So it's completely upside down naturopathic medicine. And because of this dichotomy which has developed, there's an organization that I'm the board member of, the treasurer of. It's called the Naturopathic Medicine Institute. And the Naturopathic Medicine Institute exists in order to teach vitalistic naturopathic medicine to naturopathic doctors. And this is a remarkable thing that years ago, students would come out of the naturopathic medical schools, they get their license, and they'd show up at our clinics and they'd say, look, we have no idea how to use naturopathic therapeutics because we weren't taught them in medical school. What do we do? Show us what to do. So this is why the Naturopathic Medicine Institute exists, in order to provide this education that should have been provided at the naturopathic medical schools, but which wasn't. And it's a tragedy. I know why it happened, and it's kind of don't want to bore anybody with the details, because it really is only would make sense to somebody, who's kind of an insider in the organization anyway. But the long story short is, if you in the general public are interested in having a private consultation with a real naturopathic physician, then go to the website of the Naturopathic Medicine Institute, naturopathicmedicineinstitute.org, and they have an inventory of naturopathic doctors like myself who actually practice naturopathic medicine. And maybe there's one in your hometown, right? Maybe there is, and that would be a beautiful thing. I also consult with people all around the world via the internet for health consultations, health recovery consultations. But it's regretful, Dave, that the pharmaceutical industry is one of the players here, has infiltrated themselves
That's right.
into the education, kind of sort of the same way that they did with the osteopaths in the 1950s.
Well, and I've been involved in healthcare for over 40 years, Pete, and practiced 32 years on the front line of healthcare delivery. And when I hear what you just described, I immediately come to the realization, based on my experience in the medical field, that what happened, and the reason why there has been this shift, is because Big Pharma has used their big playbook that involves big bucks, and sending those big bucks to the medical schools and to big players within that particular medical community that they're targeting. And this is how they get this change in philosophy. It really comes down, Pete, and many people are going to say, this is I don't know, it's so cynical. It's true. It might be cynical, but it's true. It all comes down to money.
And it's death by 1,000 cuts.
Yeah.
Because it doesn't happen in one big atomic bomb blast. It's a little bit of influence here, a little bit more the next year, a little bit more the next year, and then before you know it, like a Cape Cod fog that creeps in, you're in the middle of a fog bank. And how the hell did that happen?
Right.
Well, there was a plan, and this is the result, and here we are. I'll give you a perfect example. And you're right about the money thing, 100%. For the last couple of months, I've been treating a guy who had atrial fibrillation, a floppy mitral valve, and bad palpitations on and off. And his palpitations were so bad, it affected everything in his body, including his urinary tract. When his heart started getting wonky, he'd need to pee every 15 minutes. He'd also have fever and chills. He'd have anxiety. It was bad, right? It wasn't just palpitations. There were global ramifications of it. So, long story short, I took him on as a patient. Just spoke to him yesterday. And for the last 17 days, he's been completely symptom-free. And the last treatment that I gave him, which flipped the switch on this and that pushed his body back into a state of health, you want to know how much it cost? $10.
Wow.
$10. It was a little homeopathic medicine. By the way, the pharmaceutical industry and the American Medical Association will tell you that homeopathy is pseudoscientific quack medicine, that the people who practice homeopathy should be thrown in jail. Yeah. And the reason that they tell you that is because, number one, homeopathic medicine attempts to cure the problem, and number two, it is unbelievably inexpensive.
And it works.
You are
and it
spot
whoa
on.
and it works.
And it works. I mean, yeah, it works.
Yeah.
It's remarkable. I mean, the entire country of Cuba, a number of years ago, had a government-sponsored program in which they administered homeopathic medicine to 90% of the population as a preventive for influenza. Medical doctors rolled it out. The government rolled it out. The government paid for it. Nurses and doctors administered it. 90% of the population, 95%, I'm sorry. And the therapeutic was 90% successful. 90% successful. Brazil and India did similar programs with homeopathy for the prevention of meningococcal disease and another tropical disease that escapes my recollection at the moment. Over 75% successful. So, in a perfect free medical market, of unvarnished, unbiased, free medical information for a viral epidemic, homeopathy should have been the first methodology that was used, and that's what should have been focused on, because historically it's hit home runs with epidemics and pandemics, especially the Spanish flu. The English homeopathic doctors who treated patients during the Spanish flu had remarkable success rate, over 85% success rate. But oh no, we can't use that. We can't use that. It's pseudoscience. It's quack medicine. Blah, 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 blah. It's all propagandized BS intended to make people fearful of the stuff that works that isn't a drug.
So when we talk about nutrition, Pete, and we've talked about this before, but in particular today we're going to talk about eye health because it actually is an excellent example when it comes to what's called fractionated nutritional support, and if you will, more comprehensive or global nutritional support. So one of the things that you and I have stressed over the past 2.5 years is setting the foundation of your health and wellness house on solid ground and not quicksand, right? And the foundation are the 90 essential nutrients. So for eye health, Pete, the foundation, and tell me if I'm off, should be having that foundation pack on board, the 90 essential nutrients on board, before you start thinking about any other entities to add to the party to make it an even better party. Am I off on that?
No, Dave, this is why you deserve an honorary naturopathic degree. It's 100% correct, right? If you take your car in for a tune-up, you don't just put air in the tires. There's oil, there's transmission fluid, there's power steering fluid. You change the spark plugs, you change the filters, you do all this stuff, right? What's the same with the human body? And now, what we're seeing and why we wanted to talk about this.
Hey, no pun intended, what we're seeing. Okay. Go ahead.
Is because of this.
Yeah.
And Zelenko protocols and other protocols that have been advocated by America's frontline doctors. We're seeing an inordinately large amount of people doing fractionated nutritional support, especially with vitamin C and zinc.
And not doing the foundation.
Oh, no. They're just doing vitamin C and zinc.
Right.
And that's it. And vitamin D, like David, right? Plus hydroxychloroquine, plus
some others.
Ivermectin, and a couple of other things, right? Doxycycline, maybe. But as far as the medical nutrition aspect of it goes, because that's what I can speak to, when you give your body a lot of a few vitamins or minerals or herbs, you give it a boatload of those things and you disregard the rest, you're going to get some positive benefits, but you run the risk of upsetting the apple cart and creating an imbalance somewhere else. I mean, it only makes sense. And what we're seeing a stupid, crazy, like uncharacteristic, statistically significant rise in is cataracts. People are calling us up a couple times a week now. Cataracts. What do I do? What do I've got a cataract? What do I do? Whereas before, a couple times a year. And so I did a little bit of a dive into the research pool, and guess what? Cataracts have been shown to cataracts have been shown to have increased amounts of zinc in them. They actually do a chemical analysis of the cataract. There's a boatload of zinc in it. Well, that's not good. And also, research is contradictory with the vitamin C aspect, because a little bit of vitamin C is protective.
Mm-hmm.
And it's the Goldilocks zone we talked about before. It's too much is not a good idea, especially if you've had vitamin C in addition to a steroid. For some reason, that combination, big doses of vitamin C, over a gram a day of vitamin C, over 1,000 milligrams, plus steroids will contribute to cataract formation. So again, it's imbalanced fractionated nutrition, which is running rampant here. And it's very important that people who are listening to this don't get swept up in that, right? Mm-hmm. You know, vitamin C is an effective nutrient. Linus Pauling proved that. Yep. Zinc is an effective nutrient.
Yes.
Guess what? There are 88 other nutrients that your body needs, and if your body has those other 88 nutrients, then the vitamin C and the zinc are going to work better.
That's right.
Because they're, are precursors and postcursors, and there's things that are going on in the human body, and the human body knows how to do it. But the human body needs 90 things, not 3 things. It needs 90 things, not 3 things.
That's right.
And this is our whole gestalt. This is our whole this is what we talk about, and this is what we bring to the table. And that's why it's called the Foundation Pack, because you need the 90 essential nutrients in order to have an optimally effective, in this case, eye health and immune system.
And the components of the Foundation Pack are what you have listed there on the slide.
Yep, tangy tangerine, 2.5, beyond osteopathy. Now, the tangy tangerine is a multiple vitamin, multiple mineral, multiple antioxidant, prebiotics, probiotics, fantastic formula. Beyond OsteoFX is the liquid or the powdered calcium, which is over 90% absorbable. It's a remarkable product. Plant-derived minerals gives you 66% of your body's nutrient needs in one bottle. Organic, plant-derived. Can't do any better than this. And the omega-3 essential fats packed in a nitrogen chamber so the oil doesn't oxidize before it hits your stomach. This is the stuff that your body needs, whether you know it or not. And this is the stuff that has to go down the hatch on a regular basis in order to give your body a fighting chance. And then, if you're struggling with an eye issue, for instance, so this is the cake. So that would be the icing on the cake for the eye stuff. The icing on the cake for eye health is selenium, the trace mineral selenium. It's called ultimate selenium, which is a really interesting nutrient to talk about. Mm-hmm. And a botanical medicine mixture called circulatory support. The circulatory support is a combination of herbs which was put together on purpose, not haphazardly, was put together on purpose in order to increase circulation above the neck. And, I think if you want to have optimal eye health, increasing the circulation to the eye is probably a good idea.
You got it.
And this is what we do with the circulatory pack. And if you have something like a cataract or at the beginning of a cataract formation, then we need more antioxidants. And that would be I think the product is called the Good Herbs. Is it antioxidant?
I believe it's antioxidant support.
Yeah. So that's what we do in this regard, in order to give the body a fighting chance, in order to not break in any particular area. And, it, again, pun intended, beats a poke in the eye with a sharp stick.
And full disclosure, those products that Peter's just spoken about are available on OperationFreedomHealth.com. Purchase of those products on OperationFreedomHealth.com does support this platform so we can keep doing what we're doing and passing on this information and educating and empowering many people as possible. People ask Pete, well, why do you have the Operation Freedom Health site? And the answer to that is multifold, one of which is, well, if we talk about this and people want more information and research and more, for example, the video you did, which is free on the top of OperationFreedomHealth.com, the 12 bad foods, which again is part of the foundation, 12 bad foods you shouldn't be eating if you're really interested in being healthy and enhance the wellness side of the equation. So we have a lot of other information on the site, and many people say, well, you talk about this stuff, what to take, but I can't find where to get it. Well, there you go. That's why we have it at OperationFreedomHealth.com. A lot more information. In addition, the products are available. Now,
and it's one-stop shopping.
Right.
And it's put together in a way that makes it super easy because, let's be honest. If people do a Google search right now for, cataract support, natural cataract support, you'll get 1,000,001 different hits on it, posted by 1,000,001 different people, most of whom they don't have a medical degree, they don't have any clinical experience, and they are embedded somehow in the company that's selling the product. And what we bring to the table in this regard is clinical experience. Mm-hmm. And this is what separates, where the rubber hits the road, what separates the wheat from the chaff. The recommendations that you'll find at Operation Freedom Health and in my books is based not on theoretical speculation,
that's right,
but on actual clinical experience. And, that goes a long, long way, and it's the Zen sword that cuts all of the BS right off at the knees. And that's why we put it together for you, because this information is not the easiest thing in the world to come by. Thank you very much, Big Pharma.
And let's talk about, in addition to OperationFreedomHealth.com, your website, drglidden.com. A wealth of information that goes into even greater depth on drglidden.com.
So if you want to take a deep dive into therapeutics and learning a little bit more about this, at drglidden.com, I have in-depth videos, webinars that go into this stuff. The stuff that's at Operation Freedom Health, 5 or 10, 12-minute clips. But the stuff that's at drglidden.com, 45 minutes, an hour and 10 minutes, I get into it. And I walk you right through it step by step. And again, the most important thing that I feel that I need to communicate here is that this is not rocket science. Mm-hmm. You don't have to have a medical degree to understand this, although the conventional medical organization would like you to think that you do.
Right.
Most of this is not difficult. It's just never been explained to you in an easy to understand way. Now, surgery is complicated. Honest to God, you should not attempt surgery on your own. Surgery is complicated. You need training on that. But healing the body, all you're doing is helping your body heal itself. And if you're smart enough to pass the driver's license test, you're smart enough to learn how to do that. And that's what I have endeavored to do with my educational stuff, is make it easy for you to understand and implement. And that's what you're going to find at drglidden.com.
So what's interesting, Pete? When you're dealing with, problems around the house, with your infrastructure of your house, or doing renovations, there's this huge push, right, for do-it-yourself, right? Yeah. Right? Okay, right? But when it comes to your health, there's the exact opposite push. You can't do that yourself. You can't help your own self get healthy. You can't help yourself get well. You can't prevent yourself from getting, you name the entity. And I think, and I believe, Pete, that's one of the problems people have, the syndicate has with what we talk about on this platform.
100%.
Because ours is essentially a do-it-yourself health and wellness initiative.
If you cut your finger, right, you don't need to go to the surgeon. You need to clean it and put a Band-Aid on it, for goodness sake. And 9 times out of 10, it's going to fix itself. It's you swallow, a sandwich for lunch, gluten-free bread, by the way,
or sourdough. You taught me sourdough can be okay.
Your body. You don't have to teach your body how to digest it. It's going to do it all by itself. So, You're absolutely right. And the medical industry does not want personal empowerment.
No,
they don't.
No.
They want to make people sick for as long as they possibly can, and just manage things instead of fix things. Just manage things instead of fix things. Just manage things instead of fix things. And that's good for their business model. It's good for their bottom line. Not so good for yours. So take the red pill, for goodness sakes, and learn the simple steps that are necessary and easy to do in order for you to get yourself into the game of healing.
Pete, I'd like to thank you for everything you have said, all the things that you're doing, are doing, will do, have done. Because the truth is, Pete, thousands and thousands of people, thousands, and over the years, the hundreds of thousands, if not several million people that have watched our videos, and I realize I'm biased, but I believe have been more educated and more empowered through this series than any other series or group of shows that is on the internet. And I want to thank you, Pete, because I know the grief you take. I know the grief I take for this. But the bottom line is that you and I are very similar in many ways, and that is, it's about empowering people.
That's what the word doctor is, right? Educator.
Well, and unfortunately, Pete, as I have outlined in a number of other shows, and this might sound a bit of hyperbole, but it's not. It's the truth. I am ashamed, in particular over the past 2 years, of how medicine, the field of medicine, has been hijacked and has been overrun by entities and people that do not put the person, the patient, first.
Absolute power corrupts absolutely.
Yeah.
And that's what happens inside of any monopoly. Yeah. And now we're seeing it writ large, and maybe it will open people's eyes enough that the whole thing starts to tumble down. At least we can do what little we can.
That's right.
Or the most that we can in order to show people, wait a minute, there is another way here. There is something else that you can do. Well, wait a minute, over here. Ladies and gentlemen, over here, try this. You should really try this. This is a great idea. At least we can do that. And, that helps me to sleep at night.
And it does me as well. I thank you, Pete, for everything you have done, are doing, and will do. I thank you, folks, for joining us. Until next time, Dave Janda signing off. Dream big and dare to fail. Thanks for your time today.